economic suicide. This is how the Health Department Central Visayas office described the proposal to revert the region's community quarantine to a stricter status. How's the office planning to justify why Region 7 should remain under MGCQ? Let's find out from DOH-7's Chief Pathologist, Regional Spokesperson on COVID-19, Dr. Jean Loreche, who's currently on the line. Doc, good morning. What can you say about these calls for another strict lockdown? How is the COVID situation there in the region?
Hi, good morning. Thank you so much for inviting us so we will be able to discuss what's happening here in our place. Yes, it will be economic suicide if we will be placed on a stricter community quarantine status. Currently, we know already that our cases are actually in the triple digit, but the past 2 days, you will also notice that it has not increased higher than the previous week. So we have tried to maintain our number of cases as to where it should be. Secondly, with the active contact tracing and even up to the third generation, the contact tracing is already ongoing. We are also isolating everybody that were identified together with those that we have found out to be MOCs or the mutations of concern positive individuals. So basically, I believe we are okay here. Our critical care utilization, our hospital utilization is in 50%, and the safe zone that we know is 60%. So far, so good.
All right, thank you for that, Doc. But then could you elaborate on the region's COVID-19 data and how does this compare with what's happening in the capital?
Well, during our meeting last Friday, we were shown the data from Central Office, the Epi Bureau, and we were questioning some of the data that they came up with, like the attack rate, positivity rate, and the average daily attack rate, including the CFR. And so we requested for the Epi Bureau in Central Office to synchronize with our data on the ground, because I believe that the data they get is taken from the CDRS and the COVID Kaya registry, and these are not the validated and verified data as yet. So we requested that our data, they have to look into our data so that we would be able to synchronize both data from national and from the regional.
All right, Doc, what I'm hearing from you is that everything's okay so far in your region, but then when would a lockdown be considered? Should more mutations or variant cases be detected, or what other parameters are you looking at before considering a shift to a stricter quarantine, if ever?
All right, so the first thing that we are, part of what we are looking into would be, first, the critical care utilization rate has to be taken into account. You may have an increase in the number of cases, but the hospitals are capable of handling them. Secondly, which we do have capabilities. Second, our temporary treatment monitoring facilities and isolation facilities are actually only occupied by 30 to 40% of the total bed capacities allocated there. So that's good. Third would be our testing capacity, meaning to say the more we test, the more cases we find, so the higher the positivity. But then again, you have to look into this very clearly that most of these who are positive, like for our total active cases of 3,000 plus, 85% of that are asymptomatic. So these are not cases that are brought into the hospital, but rather are quarantined in the isolation facilities. And fourthly, we have to also look into the activities of our emergency operation centers, meaning to say that our EOCs being so functional and efficient, they are very aggressive in the contact tracing. So the more they contact trace, the more they test them, the higher the numbers will go up. So I'm again hoping that our asymptomatics comprise 85.9% of the total active cases. And currently, what are the measures that we are implementing? First, when we were in the meeting last Friday, and the lockdown and the strict quarantine status was floated around, we requested that we given 2 weeks, so we would be able to assess in which areas we would be able to improve upon. And so we were given 1 week, and that 1 week will expire this Friday when we will have our meeting. So the first thing that we did was to meet with our LGUs, our providers, our leaders, and we brought that issue to them, and we guided them. So number one, they will have to be stricter. Like, for example, there is no an alcohol ban in one of the highly organized quarantine pass is again being implemented. Those non-essential agencies or establishments will have to be curtailed for now. So we believe that that's one aspect. Our LGUs are very cooperative with us in this matter. Secondly, we have also strengthened further our border controls. When you go in and out, you will have to be able to present your quarantine passes. So we will know that you are truly going to where you should be going. Third, we are also talking to our stakeholders, like, for example, the establishments. Because at the end of the day, this is not a fight of the agency alone, of the Department of Health or of the LGU. It really is, we have to look at it in an individual level, wherein a person will have to take full responsibility of his actions. So if you don't want to transmit the virus, you take care of yourself. If you do not want to get admitted, then you have to cover yourself with a minimum public health standards. So all of these are being reviewed and
Thank you. Well said. That was Dr. Jean Loreche, Chief Pathologist of DOH Region 7.